Let me show you how a coil is inserted. For the purpose of this video, I will show you an IUS. An IUS is a T-shaped, horizontal shaped plastic device that's put into your womb or your uterus by a doctor or a nurse. An IUS is a hormonal coil. All 52 milligram IUS devices are the same. Mirena, Levocert and Benelixia, they're all identical. It releases the hormone progesterone to stop you getting pregnant and lasts depending on how long the brand is that you've got in regards to using the coil as your progesterone component. In the UK, there are 5 IUS progesterone only coils. Benelixia, Levocert and Mirena all are used for 6 years for contraception and 5 years as the progesterone component of HRT. Guideline can be used for 5 years for contraception only. The JDES or the mini coil is used for 3 years because it has a smaller dose of 13.5 milligram release rate at the rate of 14 micrograms per day for the first 24 days, decreasing to 5 micrograms per day after 3 years, so it doesn't last very long. Mirena is licensed as the progesterone component of HRT for 5 years, and in some organisation in the NHS, the Levocert and Benelixia are also being used for HRT for 5 years now. So this provides endometrial protection and stops hyperplasia if taking systemic HRT such as estrogel, let's get it the right way, Lenzetto spray or estrogen as patches or maybe even as tablets as well. So it's the insertion appointment at the doctor or at the nurse's clinic. Firstly, please take 1 gram of paracetamol, 400 milligrams of ibuprofen if tolerated 1 hour before your procedure. You need to make sure that you have had no unprotected sex 7 days before your procedure. If you do, then please let the healthcare professional know. Let's get this out of the way. Is it painful? Yes, it is painful. But let me explain. It's more painful than a smear and less painful than giving birth. To have your coil inserted, you'll always need 2 appointments. One is to go through the consent and also examine you and find out why you want the coil to make sure that it's the right option for you and how long the coil will be inserted and to go through the risks and the complications of having the coil. The next appointment will be when you come in to have the procedure. According to the guidelines, you should be offered pain relief when having the insertion of your coil. Now that would be oral medication that you've taken 1 hour before the procedure. Then lidocaine spray, 10%, can be used at the neck of the womb, or a cervical block, which is a local anaesthetic. However, the needle is painful for some women, so a bit like when you go to the dentist and they give you anaesthetic in the gums, it's that same small fine needle. Then at the appointment, your legs may be put up in stirrups and a speculum like this will be passed into the vagina. They come in different sizes. Sometimes some doctors also use instiller gel. I use that for the comfort of inserting the speculum as well as making sure that it's comfortable for the woman. For the procedure, if you're known to have vaginal atrophy, then please use 3 months worth of localized vaginal estrogen such as Vagifem or Vagirux, and even better, take along your own lubrication with you. So if you don't want to use the hospitals, but you know that you're comfortable with your own lubrication, take it with you. There is a device called a teneculum, which is a clamp that is applied to the cervix. And this provides stability, and then a thin rod called a sound is passed to check the depth of the womb. Then the coil is inserted and the strings are cut. The healthcare professional will give you follow-up advice on how often to take painkillers after the procedure. As a rule of thumb, I say to my patient to consider taking pain relief 3 to 5 days after the procedure to help with any cramps. If you have any questions, please leave a comment below.